good morning everyone. Good morning my dear listeners. I am super excited today to have my presentation about one of the world's deadliest infectious killer. And buckle up because we are going to dwell deeper about a certain disease which remains as an important public health concern. An awareness about this disease, its diagnosis and treatment serve as a primary step to effectively control it. What I am referring is the disease otherwise known as tuberculosis. And this day we are going to tackle about the disease itself, the pathophysiology, and the treatments. So before everything else, before diving into its different preventive measures, which is our aim in this video, first I am going to discuss about its genesis, otherwise known as its natural history. What causes this disease? What are the chemical agents that causes this disease? So first is tackling about its causative agent. We have what we call the Mycobacterium tuberculosis. So tuberculosis or TB, it is an infectious disease, communicable, caused by bacterium Mycobacterium tuberculosis or Koch bacillus. It's a species of pathogenic bacteria in the family Mycobacteriaceae. So the Mycobacterium tuberculosis, it is an obligate aerobe, which means obligate aerobe means it uses oxygen to survive, and it also a facultative intracellular parasite, which means that it lives in the host cells. It stays in the host cells. It is a type of contagious bacterial infection that primarily affects the lungs, but can affect any organ, including the bone, the brain, and spine. Later, we are going to discuss the intrapulmonary or the pulmonary tuberculosis, and we are going to discuss also the extrapulmonary. Those tuberculosis or those infections that spread throughout the bone, the brain, and the spine. Those were called extrapulmonary. Mycobacterium tuberculosis is also a rod shape and reproduces through binary fission. So we can see here in the video how it replicates. So we can clearly see that one bacteria replicates into two. So that refers to binary fission. Mycobacterium tuberculosis, also it divides approximately every 16 to 20 hours. It divides approximately 16 to 20 hours. So this is what made up the Mycobacterium tuberculosis. This is the cell wall of the Mycobacterium tuberculosis. First is this number one. This refers to the outer lipids, this one. And the number two, this is the mycolic acid. Number three, we had the polysaccharides. 4, this is the peptidoglycan. 5th, this is the plasma membrane. 6, the molecules involved in evading host immune cells and function. Number 8 is the cell wall. This is the number 6 and 7. 6 and 7, those were the molecules involved in evading host immune cells and function. While number 8, that is the cell wall, that made up all that cell wall. Because of the waxy cells, these bacteria are tough, able to survive exposures to acid, alkalis, detergents, oxidative bursts, lysis by immune system, and many antibiotics. So this important element here, the mycolic acid, this is tough. That enables this bacteria to survive in certain chemicals or any antibiotics. So tuberculosis, it is a second leading infectious killer worldwide after human immunodeficiency virus or the HIV as reported by the World Health Organization. So by the way, the references and the sources is attached in the paper. In 2021, an estimated of 10.6 million people fell ill with tuberculosis. So please do note, 10.6 million people fell ill, counting from 6 million men, 3.4 million women, and 1.2 million children. So as we can see from the data, we had the most number of infected persons from tuberculosis with tuberculosis is men. We had 6 million men and 3.4 million women. Children, and a total of 1.6 million people died. So imagine there are millions of people die, which mark the record of being a 30th leading cause of disease. According to the World Health Organization, furthermore, in 2022, in the 2022 report, so TB is present in all countries and in different age groups. In 2022, the Manila Times report, the Philippines ranked 4th in TB cases. As a response, the DOH has started a multi-sectoral action plan to battle tuberculosis with the goal of boosting the number of Filipinos receiving treatment for the chronic lung illness called the Philippine Acceleration Action Plan for Tuberculosis. So this PAP-TB or the PAAP-TB, this is an organization which battles tuberculosis. This is only in the Philippines. So how does this disease transmitted and infect a person? As I have said earlier, so this disease is airborne infection, so it travels through droplets by cough, sneezes, or spits. And then next, this is the physiology or the anatomy of a person's body infected by the disease. First, it begins by inhalation of a certain bacteria, inhalation of droplets containing the bacteria. And then it travels through our trachea, and then after that to our lungs, specific to our alveoli where it has been kept. So again, the infection begins by inhalation of a droplet that contains the bacteria, and then it stays in our lungs. Now, the type of infection depends on our level of immunity. When we say about when you say about your immunity is strong, you are healthy, and then your immune cells is able to keep this for a year or for a decade, for months, or for a lifetime. But when you say about your immune cells is weak and you are not healthy, then this bacteria inside here is able to break through the walls, to break through this granuloma, and begin to spread into our lungs. This stage where the bacteria is being kept, so this is what we call the latent stage. Next, as I have said, when this is able to break through, when this breaks throughout our lungs, this is what we call now the active pulmonary. So the active pulmonary has two types. We have the pulmonary tuberculosis, wherein it stays throughout our lungs. When you say about extrapulmonary, it is when it travels with our blood and the site of infection differs from, and the name of the infection differs from the site. For example, in our meningeal area, so that is what we call the meningeal tuberculosis. So it depends on the site of infection. That is what we call the extrapulmonary. The bacteria can be kept for a year or for a decade as long as the person is healthy. Next, the transfer of microorganism again is airborne, spreading from an infected person to another in the form of cough, sneeze, or spit, releasing TB germs in the air. So again, this is how the bacteria infect a person, or the physiology of this disease. Travels down to our trachea, then to our lungs. So as we have said earlier, this bacteria divides through binary fission. So this demonstrates binary fission. So wherein as earlier, so the one bacteria, a certain bacteria divide into two. So that demonstrates our binary fission. That refers to binary fission. So this is how the bacteria grows for 6 to 20 hours, as indicated earlier, as I have said earlier. Next, those growth of bacteria triggers our immune cells, and as a response, our immune system sends through macrophages, and these macrophages and then engulf this bacteria trying to keep the bacteria from spreading, because that is the role of our immune system. And then after it has been engulfed, it stays out in our lungs. It stays in our lungs for a decade, for a year, as I have said again. That is how the immune system responds to a bacterial growth of tuberculosis, of Mycobacterium tuberculosis. So as we can see, it forms a circle. And that stays dormant. That can stay dormant. So a triggering factor such as weakening of our immune cells, primarily weakening of our immune cells, and other environmental factors can influence the growth of our bacteria. So once this granuloma will break, the bacteria will be spread out. This will break, so this will spread out to our lungs. Now that is now the cause why the bacteria has been spread to the alveoli. So that is what we call the pulmonary tuberculosis, where it stays within our lungs, and when it joins our blood, so that is extrapulmonary tuberculosis. Once it joins with our blood flow. So latent tuberculosis infection, as said earlier, when it has been kept inside our lungs. So it is the presence of Mycobacterium tuberculosis organisms without symptoms or radiographic evidence of TB disease. The bacteria are inactive or stopped from growing by immune system, as the immune cells build wall around the lung tissue with TB germs, keeping it under control and prevent it from ever causing symptoms. So the other type is what we call the active tuberculosis infection. It is an infection in which the immune system can no longer hold the bacilli and symptoms begin to appear. So we had the pulmonary tuberculosis and extrapulmonary tuberculosis. Pulmonary tuberculosis, bacteria spread throughout the lungs, this is it. And extrapulmonary tuberculosis, this is when bacteria spread through the various periphery. So later we are going to discuss about extrapulmonary tuberculosis. So this is it. First is what we call the pulmonary tuberculosis. Again, pulmonary tuberculosis is an infection with a tuberculosis bacterium that specifically affects the lungs. So this refers to the latent, wherein the lungs is being destroyed by the bacteria. So different type of extrapulmonary tuberculosis. We have what we call the miliary tuberculosis. It is also known as generalized hematogenous tuberculosis, occurs when the tuberculous lesions erode into a blood vessels, disseminating millions of tubercle bacilli into the bloodstream and throughout the body. So it travels to our blood. That is miliary tuberculosis. That is the root word there. And next is we have what we call the genitourinary tuberculosis. So primarily the affected areas here was the urinary system or our reproductive system. We had TB infection that has the kidney as the main site. From the genitourinary word itself, we have the urinary system. The main site here is our kidney, but as well, it can affect our reproductive system, our genitals. However, it is commonly spread to the bladder and in men to the prostate. So in men, usually it affects the prostate, seminal vesicles, or epididymis. It may also spread to the periphenephric space and down to the psoas muscle. Next, we also had what we call the meningeal tuberculosis or TB meningitis. It is an infection in which the bacteria infects the brain and our spinal cord. So, meningeal tuberculosis or TB meningitis, it is an infection that in which the bacteria infects the brain and the spinal cord. This type of TB occurs in the absence of infection at other extrapulmonary sites. Next, we also had what we call the peritoneal tuberculosis, an infection that represents seeding from the abdominal lymph nodes from salpingo or oophorytis. So peritoneal tuberculosis represents seeding from the abdominal lymph nodes. So ang main site niya is our lymph node in our abdomen. That is peritoneal tuberculosis. Next is, we also had what we call the tuberculosis lymphadenitis. Tuberculosis lymphadenitis, or scrofola, it is also known as scrofola. Tuberculosis lymphadenitis typically involve the lymph nodes in the posterior cervical and supraclavicular chains. So infections in these areas is thought to be due to contagious spread from the intrathoracic lymphatics or from the infections. So as we can see here, we have the supraclavicular and the posterior cervical. So the posterior cervical and our supraclavicular, that is tuberculosis lymphadenitis. Next is, we also had what we call the cutaneous tuberculosis. From the word cutaneous, that is skin. So it is a result from the direct extension of an underlying TB focus to the overlying skin, forming ulcers and sinus tracts. So when we say about cutaneous tuberculosis, there are some symptoms that exist are ulcers and sinus tracts. Those were the signs of a person having a cutaneous tuberculosis. Next is the gastrointestinal tuberculosis. Infection of the intestine, which requires prolonged exposure of the gastrointestinal mucosa, resists TB infection. So gastrointestinal, so that is part na siya sa atong abdomen. Next is the tuberculosis in the liver. From the word itself, it is very obvious that it exists in our liver. It is the most common in patients with advanced pulmonary TB and is occasionally spreads to the gallbladder, leading to obstructive jaundice. So when a person having a liver tuberculosis, so they have, usually they have a jaundice, which is a yellowish in our skin color. So what are the signs and symptoms? What are the following signs and symptoms? So we can say that a person, though not obvious, are having a TB infection. So first is, there is no existing symptoms in latent tuberculosis. As we have discussed earlier, latent tuberculosis, it is an infection in which the bacteria has been kept inside our lungs. So it cannot destroy a certain periphery or in a certain part of our body. It has been kept only in the granuloma, inside our lungs. So these are the following signs and symptoms when a person is having an active tuberculosis. It involves persistent cough. Next is cough with blood in the sputum. So as we can see, cough with blood in the sputum. Next is if fever for more than 2 weeks or 3 weeks. So that is considered, so it is, there is a great possibility that a certain person has a disease. Next is when a person having chest pain, having an intermittent or onset sudden chest pain. Next is a weight loss, when a person is getting thinner or thinner in every day. Loss of appetite, so those were the symptoms and signs. Also having a night sweats. When a person is getting a fever even in the night, they don't feel their thermoregulation has been destroyed. So probably the person is having a night sweats, so that it is. So proceeding to the diagnosis or the detection of tuberculosis disease. How does medical professionals or medical personnel detect a certain disease? Diagnosis of tuberculosis begins with physical examination. So, for example, when we are having the jaundice, that is a probable sign of having a liver tuberculosis. So, physical examination of lymph nodes for swelling and the sound of the lungs. So, first techniques that they are going to use is purified derivative intradermal skin test, that is tuberculin skin testing. With this test, tuberculin, a component of the bacteria, is injected between the layers of the dermis if the person is previously exposed to TB, sensitive T cells react with the protein that is contained in the solution injected by making a small, localized reaction within 48 to 72 hours. So this is it. Tuberculin inside this is injected in the patient skin. So if the person is infected, so this area will create a bump. So will create a bump after 48 to 72 hours. So analyzing the result, normal result are signified with negative outcome. So after being tested by a tuberculin, so normal result signified a negative outcome, which is when the bump size is 5 millimeter. So when the patient's skin create only less than 5 millimeter, so person is negative, so negative from the disease. Abnormal results are signified when the outcome is positive, and then how? When the bump is greater than or equal to 5 millimeter. So when the bump is greater or equal to 5 millimeter when measured, so a person is positive with a TB disease. So another method is a Mantoux test. A Mantoux test, this is a type of tuberculin skin test. So another type, specific type of a tuberculin skin test, where tuberculin is injected intradermally, same method. The skin is inspected for signs of local skin reaction after 2 to 3 days. So, and the test is considered positive at an duration of 5 millimeter or more, regardless of the previous BCG vaccination history. So the differences is that this Mantoux test is administered to a person after being given by a BCG vaccine. BCG vaccine, it is a vaccine for tuberculosis. So the tuberculin skin test is just a generalized or an umbrella term used to refer this Mantoux test and other types of tests used to indicate or to determine if the person has a tuberculosis. So a positive skin test does not necessarily mean an active disease. So a positive does not necessarily mean an active disease. It only indicates that the person is infected with the bacteria. So it only indicates that. So, but it does not tell whether a person has a latent TB infection, latent is it has been kept in our alveoli, or an active disease where it is spread to our lungs and into our periphery. So the skin test or the tuberculin or the Mantoux test does not identify whether an infection is latent or active. So TB blood test, so blood test, proceeding to blood test. TB blood test then proceed if a person is found to be positive in that infection. So what are the treatments? So the treatments for this is we have isoniazid. So isoniazid is a chemical agent that kills bacteria or the mycobacteria relatively rapid. So it is fast killing chemical agent. Next, we also have the rifampicin. It kills slowly replicating mycobacteria. So unlike our isoniazid, it kills rapidly. It kills the bacteria rapidly. This rifampicin kills slowly. Next is the pyrazinamide. So it administered for the first 2 months only, and ethambutol for the eyes only. So for pulmonary TB, so for pulmonary only, the usual treatments are 2 antibiotics. The last 2, we had the isoniazid and the rifampicin for 6 months, and then 2 additional antibiotics. So for the first 2 months of the 6-month period. A BCG or the Bacillus calmette-guerin is also currently the only licensed vaccine against TB that has been used since 1921. It is prepared from a strain of weakened bovine tuberculosis bacillus Mycobacterium bovis. So, for our preventive measures, we had administrative controls are the first and most important important level of the hierarchy in the principle of tuberculosis control, as we have told so, or as we have learned. So prevention is better than cure. Compared to such medications and treatment, prevention is always be the safest. Next is avoid prolonged contact. Contact with people increases the risk of inhaling droplets that contains the mycobacterium. Be healthy, as we have said earlier, that if your immune system is, as we have learned earlier, that if your immune system is strong and you are healthy, you are able to keep that infection in yourself if you are infected. So strengthening immunity helps the body to contain, or if possible, kill the bacteria that have entered our body. Next is stop smoking. Smoking damages your lungs, which is the main site of the infection, and weakens immune cells, which kills the bacteria. So maintain good hygiene. TB can spread through the air by droplets when someone with the active disease coughs or sneezes. Therefore, it is crucial to maintain good hygiene practices such as washing hands frequently, covering your mouth and nose when coughing or sneezing, and avoiding close contact with people who have TB. Open the window when in indoors. Ventilating tuberculosis wards by opening windows is more likely to reduce the risk of infection than mechanical ventilation. So for example, when you are in a certain building or when you are in a certain room with many people, it is very important that you ventilate the room well by opening the windows so that air passes through and the infection will be lessened. TB spreads in small closed spaces where air doesn't move. Get ready to be vaccinated with BCG. So if you are already infected by TB disease, so the only safest thing to do is to get ready to be vaccinated with BCG. So when you are already affected by a TB disease, the safest thing to do, the safest choice to make is to get ready to be vaccinated with BCG. So BCG is recognized as the most effective vaccine in this time for tuberculosis. So that is all what made up my report. So this report has shown that it is very important issue to be addressed. The tuberculosis concern, it is very important because it is contagious. So it has detailed the challenges and as well as the solutions, and must be taken in order to move forward. And I believe with the right approach, the future will be brighter. Thank you.